Welcome to this video where I will review common medical specialists. A lot of my videos recently have been on health and doctor's appointments. So now we're going to look at some of the specialists that you may need to see, okay? And review the English vocabulary for them. The first is a cardiologist. This is a doctor who focuses on heart and blood vessels. And some of the reasons you might need to see one would be if you're having chest pain, if you have high blood pressure, or if you have a heart murmur. That's when your heart makes a different sound than typical, and they can hear that with a stethoscope. A dermatologist is a doctor who focuses on skin, hair, and nails. You may see a dermatologist if you have severe acne, that's different markings and sores on your face, a strange mole, which would be a dark spot on your skin, or a rash, a red or itchy area on your skin. An endocrinologist is someone who studies the hormones and glands in your body. So you may see this doctor if you have diabetes, thyroid problems, or hormonal imbalances. A gastroenterologist is someone who focuses on the stomach and digestion. So you may see this doctor if you have heartburn, stomach pain, ulcers, which are sores inside that can be typically caused by stress, or any digestive issues. You may see a neurologist for brain and nervous system specialty. So they can support you if you have chronic, that means for a long time and many, migraines, seizures, memory loss, stroke, since they focus on the brain and nervous system. Any of these things and more may require that you see a neurologist. An OBGYN focuses on women's reproductive health, okay? Specifically the OB part, obstetrics, is who supports women during a pregnancy, when they are pregnant. A GYN is a gynecologist who can do routine exams for women. An oncologist focuses on cancer, so they can support you with treatment for tumors or abnormal, which means not normal, cell growth in your body. An ophthalmologist focuses on eyes. They can support you with vision problems, eye infections, or eye surgery. Okay. An orthopedist is someone who focuses on bones and joints, your hips, your knees, your wrist, your hand, your shoulder. So they can support you with broken bones, back pain, and especially sports injuries. Okay. An otolaryngologist is an ENT doctor, is what we call them for short, focuses on the ear, nose, and throat. You may see this specialist if you have chronic sinus infections, hearing loss, you have trouble hearing, tonsillitis, infection of your tonsils. A pediatrician is a doctor who focuses on children and infants, which are babies. So they can do routine checkups and support children with illnesses. A physical therapist is someone who focuses on movement and rehab. So these are the people that can support you while you are recovering from surgery, or if you are trying to improve your mobility, build your strength, build your muscles, get stronger to improve your walking and daily living. A podiatrist is someone who focuses on your feet and ankles. They can support you if you have foot pain, any issues with your toenails, or heel spurs, which are an example of a condition inside your foot. A psychiatrist is someone who focuses on mental health. They can support you with all mental health, but anxiety, depression, and emotional disorders are some of the most common. A psychiatrist also has the power to write you prescriptions for mental health illnesses. A pulmonologist is someone who focuses on lungs and your breathing. You may see them if you have asthma, trouble breathing, chronic coughing, or sleep apnea. This is when you're snoring and have trouble sleeping at night because of your breathing. A radiologist is the type of doctor who reads all medical images. So that's who looks at x-rays, MRIs, CT scans, and then can tell other providers, other doctors, what they see in these pictures. And finally, a urologist, it focuses on the urinary tract. So you may see them if you have kidney stones or any bladder issues, okay, with going to the bathroom. I do have, let's see, a small slideshow for you to practice some of these. Let me share this tab. Okay, so this is my guessing game of who is the specialist, okay? So we can go through this together if you'd like to practice a little bit. Our first patient is Maria. I have been sneezing constantly, my throat is very sore, and I have a sharp pain in my left ear that won't go away. Who should she see? She should see an otolaryngologist, an ENT doctor, for support with ear, nose, and throat. David, I was playing soccer and twisted my ankle. Now it is swollen, which means getting bigger, and I think I might have broken a bone. Who should he see? He should see an orthopedist, someone who focuses on bones. Elena, I've noticed a new mole on my arm that is changing color and getting larger. I'm worried about it. Who should she see? She should see a dermatologist, someone who focuses on skin and can support looking at this new mole that she is worried about. Mr. Thompson, lately I feel very short of breath just walking up the stairs, and I have a heavy feeling in my chest. Who should he see? The cardiologist, someone who is going to look at his heart health. Sarah, I just found out I am 2 months pregnant. I need to find a doctor to help me during my pregnancy. Who should she see? She should see an OB/GYN who can help with the pregnancy and women's health in general. Marcus, I have had a terrible cough for 3 weeks, and sometimes I wheeze. That means make a noise when you're trying to breathe in and out. When I try to take a deep breath. Who should he see? A pulmonologist, someone who focuses on breathing and lungs. Mrs. Garcia, I have type 2 diabetes and I need a doctor to help me manage my blood sugar and insulin levels. Who should she see? She should see an endocrinologist. Kevin, I finished my surgery last month, but my leg is still very weak. I need exercises to help me learn to walk properly again. Who should he see? He should see a physical therapist, PT. Lily, my 4-year-old daughter has a high fever and a red rash on her stomach. She needs a checkup. She needs a sick visit. Who should she see? A pediatrician, someone who focuses on children, and we know that because it says that she is 4 years old. And finally, Andre. Everything looks blurry when I try to read the newspaper, and I think I might need glasses or surgery for cataracts. Who should he see? The ophthalmologist. And finally, who should you always contact first when considering a specialist? Who can give you a referral? Your primary care provider. Okay, it's always a good idea. You don't have to pick your specialist or the specialty by yourself. That's what your doctor or your provider, nurse practitioner or physician assistant can help you do, and they can give you a referral. Thanks so much for watching this video on medical specialties and specialists.